Wait a second, I'm sorry. Let me just. All right, so we just have a small update from the City Department of Health. As everyone knows, the past 2 to 3 weeks have been just explosive with COVID and the Omicron variant, and just everyone scrambling to either get vaccinated or to try to get a test. This has especially been a trying time because the holidays came on us, Christmas and then New Year, and joined by this surge in the COVID-19 virus. So today I'm just going to give you a brief update on what's going on. Here we go. So the main purpose of this slide, this may be difficult to see. I'm not sure if you can clearly see it, but this is a slide showing the differences between cases of the unvaccinated versus vaccinated. So here we have, I don't know, I can't find my mouse. Where's my mouse? All right, I'm not finding my mouse pointer. I don't know why, but at any rate, if you look to the far left of the screen, you do see an arrow pointed there, and that arrow indicates the cases of people who are unvaccinated. So you can see that that purple line is almost vertical, okay, in the number of cases of people who are unvaccinated. And then in the yellow at the, or orangey mustardy color towards the bottom are cases in people who are vaccinated. So there is a marked difference with the two cases, with the two rates that you can see there. So the unvaccinated are close to 3,000 or well over 3,000 cases per 100,000 people, and the vaccinated is just approaching 500 per 100,000 people. So although it may appear that vaccinated people are getting the virus at a high rate, it's actually not the case. It's the unvaccinated. So that's the far left. The middle is hospitalizations. And as you can see, the unvaccinated, okay, are driving the hospitalizations, and it's all the way up. And if you look at the mustard color at the bottom, it's the vaccinated people. And you can see very few vaccinated people are actually getting hospitalized. And then when you look at the far right, which is deaths, you can see that the unvaccinated are far beyond the vaccinated in terms of the number of deaths. So this really drives home. That's why I wanted to show this slide. This really drives home the point that if you are vaccinated, even with this surge, you are more protected than if you are unvaccinated. So you can take this information and share it with your friends, with your family, with your co-workers, and you know, pass the news, spread the news that it's the unvaccinated people who are really getting sick in this current surge. So the next slide I wanted to show. I don't know what's going on with my mouse, Sherry. I'm not even
Oh,
able
it's
to
not, it's
move.
not progressing? Okay.
Yeah, I don't know what's happening here because I
Okay.
can't even see my pointer.
Oh, yeah, yeah.
Um,
Okay, give me a minute. I will share it in a minute. Let
I
me
don't think
upload it
my
to the
mouse is
computer.
dead, but
Let me see if I can upload it and I can share it. Okay.
oh, now I see my mouse.
You
So
got it?
I don't know
Okay.
what was. Are you okay?
Oh, then I have it.
All right,
Hold on.
I have it now. Now my
You got it?
mouse
Okay.
is working. Maybe it needed charging. I don't know. Okay, so on this slide, I just wanted to share with you that we are making progress in terms of vaccination status. The groups highlighted in red are the groups that that were lower rates and still are lower rates across the city, but gradually and steadily improving. So the effort is going forward. So as you can see, citywide Blacks of all ages are 59% vaccinated. It's still lower than other groups, but compared to where we started in the past, this is a great, great improvement. Um, but there is, also highlighted in red, all ages, white in Brooklyn. The numbers are dropping there. So that is likely in the Hasidic community in Borough Park, etc. So I just wanted to show you that. And then by age from 5 to 11, all of the groups are far behind in terms of children being vaccinated, except for Asian group population. But, so we need to get the children vaccinated 5 to 12 years old. And then in the 13 to 17 age range, the group that is far behind is actually the whites, but 13 to 17, Blacks are moving up gradually. And if we look specifically at Queens, we're still a tad behind, but we are gradually improving. So that is excellent news. And I don't know why this is not moving again, but anyway. Okay, so the last bit that I wanted to share this evening is about the home kits, the at-home test kits. So a few weeks ago, we did have the opportunity to distribute 500 at-home test kits to the community right between the Christmas and the New Year holiday. And so we're grateful to have had that opportunity. And we were anticipating getting restocked. However, the supply has been diverted to the Department of Education for the children to try and keep the children and teachers in the classroom. And we're going to talk about that a little bit later. But this slide just, basically reiterates that if you have a self-test and it's positive, you should stay home, isolate yourself, quarantine yourself, wear a mask if you have contact with others. And if you need assistance, you can call this number 212 COVID-19 or your doctor to be connected to services. And of course, always you can call Relume Foundation and we would gladly help you navigate the healthcare system to the best of our ability. So over the past 2 weeks, the Department of Health and Mental Hygiene have distributed over 1 million home test kits, including neighborhoods hit hardest by COVID, through the partner CBOs, of which we are one. But everything is paused as the city is supporting a safe school reopening. And as everyone realizes, there are long, long lines. Every place you look, there are long lines at city-run test sites, even at privately run test sites, there are long lines. And there's there is a test kit supply shortage nationwide, and we've heard President Biden announce that by the end of this month, January, they hope to have more test kits in abundance so that everyone can at least have a test kit at home. And then just in terms of those who have received a test kit at home, so there's certain these are some suggestions that you could follow in terms of testing yourself. So if you're asymptomatic, meaning you don't have any fever, you don't have any cough, any sniffles, body aches, chills, you don't have a known exposure, okay, really, you should kind of hold on to that test kit if you don't have any symptoms and you've not had an exposure. But if you do test yourself and you're negative, there's nothing to do. If you've had an exposure, you don't have any symptoms, but you've had a known exposure or close contact or suspected exposure, then you should quarantine yourself. You should test yourself. If you're negative, you should still try to test to maintain distance and quarantine yourself. Of course, if you're positive, then you need to go the next step, which is the NAT testing, which is the PCR testing, which is considered at this point the gold standard. And of course, if you're positive on the PCR, positive on the antigen, that means that you have infection with COVID-19 and that you should definitely isolate yourself. Now, if you're symptomatic, and meaning you have cough, you have sore throat, you have nasal congestion symptoms, and you test yourself and you're negative, okay, then there's of course two possibilities that you could go on to do the PCR. And because you may test negative, but on the antigen, but it may be too early to detect the virus with the antigen test. So you will go on and do the PCR. And then if the PCR is negative, you're negative. But if the PCR is positive, that means infection, and that you should, take the proper precautions. And obviously, if you're antigen positive and you're PCR positive, again, that means that you have COVID and you need to take the proper precautions and isolate yourself. Okay, so that's it for what I wanted to share this evening. And I'm going to turn it back to Sherry.
Hello, everyone. Welcome, welcome, welcome. Thank you, thank you. You just heard from Dr. Crony, our medical director at Relum Foundation. My name is Sherry Adeosun. I'm the president of Relum Foundation. Thank you for joining us. I see some of our colleagues from the Department of Health, some colleagues from Bethel Gospel Tabernacle. Thank you everyone for coming on time. We have a special guest in our midst, and I'm not gonna waste that time. I'm going to introduce her to you, and she will be able to take it to another level. So let me introduce her. So we have with us today, let me read it to everyone. Okay, we have with us today Ms. Renee Freeman. She's a New York City DOE Instructional Support Specialist, a UFT member. She currently works in the school, as well as, you have to tell me, you tell us the school you work at, I don't have it written here. She also the Queens UFT. She works at the Queens UFT office, where she is a PM staffer. As a representative of the UFT, she assists and works on behalf of teachers, to resolve problem that arises. So she's gonna come and share a few slides with her to sort of spotlight this new protocol that we have in Department of Education that is really different from what is going on with CDC a little bit. And so if you have any questions, she'll be able to answer the questions. And myself and Dr. Coney were here to be a backup to if necessary. Go ahead, Mrs. Freeman, welcome. Let's give our Relum welcome.
Evening. Thank you so much. I apologize. I didn't need to put up the slide. I'm just running in from a UFT meeting in regards to COVID. So what I would like to let you guys know is that if you have children, grandchildren, nieces and nephews in the school system, we truly understand the stress that you're having right now with the kids being.
Your voice is a little bit like.
I got you.
Okay.
I got you. Is that better? Sherry, okay. So what we're seeing, I work currently in one of the schools in Far Rockaway High School. If you know anything, this is one of the hardest hit areas in Queens. The parents, our children, a lot of people in Far Rockaway were not vaccinated. And currently today, I'm dealing with children who are not vaccinated. And the goal is to try to give them the information so that the parents will be a lot more comfortable with them getting vaccinated as well as their children. Vaccinations are offered throughout the city in our schools. They're not there every single day, but vaccinations, there are days when the kids can be vaccinated right in the school. What the parent needs to do is just fill out a consent form and it's done. Also, testing is being done in the schools. It is a rotating basis. Again, the children need a consent form on file in order to be tested in the school. If some of you have experienced your child coming home and saying that the teacher is out, probably true. What has happened in the last few weeks is the DOE has been changing their policies consistently. Policies change, it seems like every other day. The teachers are in the classroom. If there is an exposure in the classroom, the policy currently is that every student in that class will receive 2 take-home tests. One test they are to be given as soon as they get home, that the parents do it as soon as they get home. The next test, if they have no symptoms, can be taken 5 days later. If they have symptoms, then they can take that test as soon as those symptoms arise. The issues that we've been facing is that the number of days the kids are out. A lot of our parents, we know, are working parents. They do not have babysitters to take care of the kids if the kids are home sick. So what's happened is that they're taking the one take home, they're getting a negative, and they're sending the children back to school.
Ms. Freeman, you still muffled. Maybe, yeah, move a little bit closer. It's better now. When you move closer, the way
Okay, is that better?
Yes, much better. Yes.
So,
okay, thank you.
The issue that we've been having is that once the parent gives them that first take-home test and it comes up negative, they're sending the children back to school. And what we have noticed is that, say this happens on a Monday, they got the test, Wednesday or Thursday, we're seeing the children with the symptoms. Children may not have the symptoms right away. It's best that they're home for at least 3 days so that we can see if they have the symptoms. This has caused the school numbers to rise because now we have an exposure. So now you have a class that has to be tested as well as the teachers in the room. A number of teachers are popping up positive when they take the test. So now we have a big issue. And trying to get all of us on the same page has been a little difficult. It's not that teachers don't want the children there. No, I don't want the schools closed. I don't want remote. I did not like it. I don't want remote. But what I will say, if your child has been exposed to COVID and you give them that test that first day that they come home, please reach out to your school to make sure the teachers are posting assignments. I truly understand if you don't have someone to watch your child that next day. We understand that, and it's difficult for you, but you may need to take a day or two just to make sure. The fevers and things that the children, when the child gets a fever, that's dangerous. We in the school, some schools are not equipped to handle that child who may come down with a high fever. Far Rockaway, which goes from the school that I'm in goes from the 6th grade to the 12th grade. We're seeing a lot of our 6th, 7th, and 8th grade children with fever, and they're in school. Be careful. For our teachers, a lot of them are now being told, take the 5 days, day 6, return. We know the new protocol. The CDC said, now instead of 10 days, it can be 5 days. If you are an educator, I need you to understand, if you feel good and you have no symptoms, by all means, come back to work. But if you are still coughing, sore throat, please don't come. Take some more time. You can take up to 10 days off for COVID and still be paid and not lose any days in your car. That is something that the union has fought for because this keeps our children safe. We don't need a teacher in the front of the room coughing, sneezing, or whatever, trying to teach our children who may be healthy and then they get sick. So this is something where we all must come together and help one another. Please, parents, talk to the children. Our children do not like the mask, and we understand that. So the masks that some of them are wearing are cloth masks that droop. If you are washing your cloth mask on a regular, it's going to stretch out of shape. It is better for you to wear those blue surgical masks and then toss that in the garbage and put on a new one, even if they say they got to come to school and get it. That's fine. We have plenty. We can give them a mask every single day. But parents have told their children, oh, if you're uncomfortable with the mask, you can take it off for a few minutes. No, they cannot. There is a rule that the DOE has put out where we can have them removed from class if they're not wearing their mask. We're not going to fight with them. We're not going to fight with you. They just will not be permitted in the classroom because it's not fair to the teacher nor to the other classmates. It's not fair to them. They can catch something when that mask is off. When our children are having lunch, we have tried our best to have all the children face in one direction so that they can eat comfortably without spreading the germ. A lot of times parents don't understand when we say, listen, we call a parent and say, your child's not following the rule. We need you to please talk to them. We get cursed out. We're being cursed out. We're being called everything but a child of God in the school. So we've resorted to not calling parents as much. We text them and we let them know, this is what's happening. But parents, we need your help. Our teachers are feeling overwhelmed and they're nervous. If your child has a cold, everything is not COVID. Every sneeze is not a COVID sneeze. If they're coughing, it could be a cold. This is flu season. It could be something that simple. What we're asking you to do, listen, if the child has a fever, check them. There is a health screening that you are to do every day for your child to enter the building. They're not being done. The children, some of them are too young to fill out that form. The form is simple enough, and it's just a little check-off box. I believe it's 3 questions. Fill that out daily. Send it to school. It's just to say that your child is negative or has no COVID symptoms. If they do, when you do this health screening, it's going to let you know if your child should go to school or not. A green check says they can come into the building. A red check, they cannot. And they have to present that. Everybody has cell phones. Everybody. The 6-year-olds have cell phones. You can do it on their cell phone. And they just show it. I know that's frightening, because what if your child has a red check and you have no days to take off from work? We got to figure that out, because you still cannot just send them to school. Please, staff members, it's the same thing for you. Staff members are walking into buildings knowing that they have symptoms. And this is, I can attest to it. I had 3 teachers come back from the break saying, I don't feel well. And my thing was, you don't feel well, tell me what you mean you don't feel well. One teacher, she could hardly talk. So I said, okay, here's a test. Do me a favor, go to your car and take it. It came back positive. We had 3 of them. Now, unfortunately, the kids were already in the building. Her classroom was already full. So now, because she came in the building and was positive, that entire class has to be tested. So far, we haven't heard of any of her children testing positive, but it's scary. Don't play with this, because you can infect someone else and you don't know their underlying conditions. We had one teacher who caused, well, we don't know, the teacher in her room wound up getting COVID, and that teacher ended up in the hospital. So we don't want those things to happen. Even in our church families, I understand a lot of churches now are going back to the remote and being very cautious. We have to be. Unlike Dr. Croney, I don't know about Omicron that much. All I know is that it's a weird one. Both my husband and my son were positive. I was sleeping in the same bed with my husband, and my son and I play around all the time. I didn't get it. I continue to be negative. I tested so many times, and I am a diabetic, but I tested so much, I got nervous. I'm like, wait a minute, this is crazy. I did a PCR, I went to the doctor, I did everything. I never got it. So don't think because someone has it that you're going to automatically get it, because that's not the case. We don't know why or how, but understand we must do the right thing. Make sure the kids are washing their hands. I have 8th graders, and I send my students to the bathroom throughout the day just to wash their hands. I said, no, we're not doing hand sanitizer. I need some soap and water. When you come in the morning, you can use that hand sanitizer. But after that first class, we've used the computers and everything. No, we're going to the bathroom to wash our hands with soap and water. And that's what it's about. If you can, send a little bounty. It works. Soap it up, wet it, put it in a sandwich bag. Let them do about 3 sandwich bags. During the day, let them wash their hands if they say they can't go to the bathroom. Use that. Wash their hands, let them dry them, and throw that in the garbage. It's good protection. It's perfect hygiene. And then they'll get used to washing their hands all the time. And you'll never have to tell them to wash their hands. Because my students now, I don't tell them to go to the bathroom. Miss Freeman, can we go wash our hands? Yes, you may. Okay, so I thank you guys. Thank you, Sister Sherry, Minister Sherry. Thank you, Dr. Crony. I enjoyed that information. I took some notes to take to work tomorrow, and I appreciate all of you. If there are any questions, I'm ready. Shoot them at me.
Thank you so much, Ms. Freeman. We really appreciate your the zeal and the desire, the energy with which you do what you do. Thank you, thank you, thank you. So there is a question in the chat. If you guys have any question for Ms. Freeman regarding to what she spoke about, whether it's relating to the protocol and the requirement for the student, whether it relates to your benefit as a teacher, whether it relates to what you need even as a parent, or if you need some kind of support. I know this thing is like really moving. Even those of us that healthcare practitioner, which always we're playing catch up. Every time we're in a meeting today, Dr. Coney, right, they were with the health department and they were talking and giving us some guidelines. And in the middle of the meeting, there was a new update. So it's constantly evolving and changing. So it's important that we don't feel overwhelmed because we don't have all of the answers. That's why we're here, and we are here as a resource for you as at Relum Foundation. Whatever information you need that you don't have, we can find it for you. If we don't have answer, we have resources to get the answer.
You dropped out.
I dropped out?
For a second, yeah.
Oh, so if we don't have the answer, we have resources to get the answers for you. So there's a question on the chat regarding how are the home tests verified. The home test, there are different kind of home tests. And you guys are gonna find out, those of you in Brooklyn, Queens, the different home tests going to different home based on the location, and each one, they work very similarly, and there's an instruction attached to it. I know one of the webinar we had, we showed you the BINACs now, how to use it, and we gave you the link, and all of them are on YouTube. And also, if you've been exposed, I think Dr. Coney mentioned this today or maybe last week, if you've been exposed and after your exposure, you have to test. Once you test, if it's negative, you test again in 5 days. If it's negative, then you assume to be true negative, especially if you don't have symptoms. If the first test is positive, then you have to immediately, make sure you quarantine yourself and test again in 5 and do a PCR test to confirm that positive test. And once that is positive, then you have to stay for at least 10 days until you're symptoms free. I know with DOE is saying 5 days, even though they're saying 5 days for the adults. It's 10 days for the student. That's where the confusion is. 10 days for the student, 5 days for the adults. But if you're still having symptoms, you don't have to go back in that 5 days.
If the children, if after day number 5, they test and it's a negative, they will let them in on the 6th day.
Oh, wow, okay. After day 5, without symptoms, right? Without symptoms?
Without symptoms, no.
Without symptoms.
They have to be have at least 72 hours with no fever, no medication, and they can come back. Now, currently, the school in Far Rockaway, this is the test that they're giving the kids right now.
Yes.
Okay, and it's verified when you take the home test. The parents have been told, just send a picture. That's it. They send a picture if it's positive or if it's negative. We got a few pictures today from kids that just took tests on Friday, because we had to get our test on Friday because a student was positive. So all of those kids that took tests, the parents sent them pictures to show that those kids were negative and they were in school today. They were in school. So we know that they were okay. Okay, but
a question for you. Question for you. It's my understanding that it's not all of the school that is requiring pictures to be sent to the school. My daughter's school didn't ask for that.
Okay, all the schools, everybody's doing something different. DOE is not giving a regulation on how to confirm. All they said, If a parent says to you, my child tested negative, we have to believe the parent.
Yeah. So
There's nothing we can do.
I just want to say that on this platform, so parents will not feel like maybe their school, they're not doing their due diligence. So every school is doing it, applying the rule a little different. They give guideline, and every school is doing it a little different. I actually have 2 school nurses on the platform, and I'm going to put them on the spot. Miss Adegunle and Miss Fortune, if you want to say something briefly regarding your experience in interacting with students in the school, fine. If not, it's okay. And then I also have a public health advisor on the platform that work closely with the student in the medical room in our school system. So if that one of you want to say something, you can unmute yourself and just speak for like 2-3 minutes and give your perspective regarding how you've been dealing with this in the medical room. Anyone is game. Miss Fortune, you're muted. Go ahead.
Okay, good night, everyone. Thanks for this opportunity for sharing. It's basically like what Minister Freeman said. I have there are times when in my medical room, I have to use my own initiative to protect myself, to protect the teachers, but to protect the other students. And so sometimes I have to use my own rule of thumb based on the circumstance and the situation. Like, for instance, today a child came back before the 10-day, and to try to maintain the rule, I called the parent, I told the parent, today is the 10th day, tomorrow is the 11th day, the child will be in school tomorrow. We just have to keep the rule and keep it across the board. And so those are some of the things I have to apply in my medical room to maintain the standard. There are times also when parents will tell you different situations and you just got to work through it and try to figure out what to do. Sometimes I consult with the AP or the principals to help me make the decision. So it's really not an easy job that we're doing right now. It's really difficult and sometimes it can be very frustrating. But with the help of God, most of all, we pull through the day. Thank you.
Thank you so much for that. Thank you for that. And Miss Sergeant, want to say something? Go ahead. Miss Sergeant, public advisor. Go ahead.
Yeah, I'm an advisor. I just wanna, like, I forget, what's her name? The teacher from
Miss Freeman. Miss Freeman.
what she was saying about Omicron. Let me tell you, the Tuesday, which was like the 20-something, the Tuesday before Christmas, I started feeling sick. So, I thought it was just a little cold I had. And I did go to work that, no, I didn't. I came home and I was getting chills. And I'm like, okay. I went to work as usual and I came home and I was feeling chilly. So the next day I called out, I said, you know what, I'm not going to work. Now, I realized I had some kind of symptoms going on. And only because we have a baby in the family, I said, you know what? If we're going to go see this baby for Christmas, let's go get tested. We went to get tested and we were positive. I mean, it was like unbelievable. I where all this thing came from, I really don't know. And then 2 days after that, my little grandson in the house was positive. Now, I went back to work the Monday, which was the 3rd, and I did the test that the school gave us, and that was negative. And I decided to do the PCR test, and that was positive still. Now, what I would like to know is how long does this remain in your system? And how long is it going to show positive? And how do I know? I don't know. It is confusing. Because I have a cough, but I don't have a fever and I feel fine. And, so, and I see kids coming in and some of them have a cough, they test negative and a lot of them come in and they look fine. And they do the test, it's positive. You could never tell that my grandson was positive.
Okay, thank you for that question. I'm glad you're doing better. Thank you for taking the initiative to get tested. So I think we're gonna stress test. It's important. I know it's difficult to get tested. The lines are long. Just continue to bear with the system. It's gonna get better. Don't give up. Don't be tired. Don't be weary. I'm gonna ask Dr. Connie to address the issue regarding how long does it stay, in your body, the positivity result, when should you get tested again? Is there a need to get tested again? And then I'll put in my 10 cents once she finishes. Dr. Connie, go ahead.
Okay, so I believe we discussed this when we introduced the Binax testing kit, but I think I made a couple of points, which is the at-home test kits are antigen test kits, and the accuracy of those tests depends on the length of your exposure, more or less. So if, let's say, for example, I was exposed to someone who tested positive yesterday, okay? It doesn't necessarily mean that I will test positive today. I should wait a few days and then do the test, because the antigen test, you have to sort of build up enough virus. If you're infected, you have to build up enough virus in your nasal passages, in your oral pharyngeal passages, in order for the test to turn positive. Okay, so it's user dependent, and that's something that we've tried to explain, but it depends on the when you take the test. Okay, from the time of your exposure, whether or not, of course, you have symptoms, and whether or not you do the test accurately, or you perform it according to the directions. And I've been hearing some things on my networks, which lead me to question whether or not people are performing the test as it says in the package. But anyway, those are sort of the preconditions for the antigen test. The PCR test is different, because the PCR test is what we call an amplification test. So what it does is it takes your sample, it goes to the lab where they essentially create conditions in the lab for the virus to grow if it's there. So if the virus is present, okay, even in a very small amount, through the amplification process, it will detect the virus. That's why it's considered, quote unquote, the gold standard as of now, because before that antigen test may come positive, if you do the PCR and they grow it in the lab and you have any virus and they amplify it, then it will be positive before an antigen test becomes positive. So it's the gold standard. Now, to address your question as to the antigen test being negative and the PCR test being positive, it takes a while for the PCR test to become negative. So the antigen test sort of represents shedding. So your body is actively shedding, and you can pass it to other people because it's in your nasal passages, it's in your throat, it's in your lungs if you're coughing. And so that can be cleared, your shedding can be cleared faster than what would be detected in your body. Okay, so that in that way, you're not contagious, so to speak, because you don't have sufficient virus in your nasal passages, in your oropharyngeal passages to spread it to someone else. But your PCR can remain positive longer because the PCR is very sensitive and it picks up a minute amount of virus and amplifies it, but it doesn't necessarily mean that you're infectious. So you're infectious when you're actively shedding, and the antigen test detects that, okay? And the PCR detects any virus that is in your body, but not necessarily you being infectious and spreading it. I hope that explains.
Yeah, I think it explains it very in detail, a little bit of technical terms, but I think they got the gist of what you're saying. Thank you for being very thorough. The only thing I would just say is some of us may or may not agree with the statement I'm about to make, but that is the requirement that they're saying now. If a child is returning back to school after the 10-day, let's say they're still having symptoms and the symptoms is over in 10 days, they don't really need a negative test to come back to school. You don't need to ask them a doctor's notes, a negative test to return. They can return back to school without a test. I know some people, but if they're still having symptoms, because some people's sickness extends more than the 10 days. I've seen people like that. So if they're actively coughing and they have fever, of course, that is 15 days. They have
so
to.
This is essentially the honor system.
Yeah.
And I think there was a question in the chat regarding that.
Dr. Courtney, I'm sorry to cut you off. We have like 1 8 at 7:55 because there's a meeting from our church and a lot of people here on that platform. I won't want to make them miss that meeting. So 5 minutes, go ahead, go keep talking. Just want you to be aware of that.
No, there was a question in the chat with regards to verification of a negative test. And right now it's just based on the honor system, quite frankly. They're not requiring a test of cure, which would be like a negative antigen test. And that I'm sure you've heard the debates going on in the news with regards to the CDC's recommendation that essential workers can come back to work after 5 days of having had COVID with no test of cure required. Okay, so again, it's all on the honor system. That's basically what it is. And we'll wait and we'll watch and see whether or not there's enough uproar to change that.
Yeah. So there is a comment, it's like a question from Miss Libby regarding Guyana. So I think what I would encourage you, and Dr. Cooney can add to it, I think we still have some time, is that it's important to just put in place the layers and layers of support, layers and layers of prevention. So it's not just the vaccination, it's the hand washing, is the, if possible, social distancing, is the getting tested as much as possible, especially if you've been exposed or if you've been in a big, large gathering, or especially if you're not having symptoms. You can't just assume it's flu, you want to test yourself to make sure that's what is going on. So regarding the school system in Guyana, I know every country, their system is different, but what I will encourage you that you can tell them is they should just put in place layers and layers of protection. So if they have access to vaccination and the kids are old enough to get vaccinated, they shield if somebody is sick and they're not sure and they don't have access to testing, then they should just stay home until they're symptoms free to make sure, if they can determine is the COVID or not, that they don't spread it. Because that is the issue. This Omicron spreads so fast, like wildfire. And just like Ms. Freeman said, sometimes some people don't get it, even though they've been exposed to it. It's really difficult to determine, how this thing operates, but we know it's out there, and we're making progress to try to curb its spread in our community. So everybody has a role to play in this thing that is going on. Continue to do what you're doing. If you need any help, you can always reach out to us. There's nothing like a stupid question. Every question is valid. So far is bothering you. I'm going to put in the chat again, 718-471-8005. There's somebody in the office between 9 o'clock and 3 o'clock, Monday through Thursday. You can call us. You can email us at relumf@gmail.com. And as I round up, Dr. Kwani, is there any question in the chat you want to address?
No, I just want to say that we are seeking testimonials of people who have been vaccinated. So please reach out to us if you want to participate in that. We will have you sign an informed consent release because your testimonial may be used by the City Department of Health or the State Department of
You
Health.
may see yourself on TV. I don't know. You
Or
will
your
be on social
statements
media.
in print.
Yeah,
Your
we're gonna
name in
put it
print.
on social media, but they may use it on TV. So thank you very, very much. We're here every Monday. We have a lot of guests today. Somebody invited so many people. I don't know whoever it is. Thank you. Welcome, welcome. We're on this platform every Monday. And what we do is we share updates regarding different topics around COVID-19 in the community. So come in here. We don't keep you too long. We're here just for an hour and we'll let you go. Thank you very much for joining us today. Same password, same meeting ID, same location. God bless. Thank you, Dr. Coney. And thank you, Relum staff, for joining. God bless you all. We have one of our board of directors. Let me shout out Ms. Natasha Ferguson. Thank you for joining us. We appreciate you and all that you do. Thank you so much.
Thank you.
Bye, everyone.
Good night, everybody.
All people from better, go to better meeting. Bye.
Good night, everyone.
Bye. Good night.
Good night.